Dr. Morris, you do have a quorum.
Yep.
So whenever you are ready.
Okay, we will
We
go
can
ahead
start.
and call the meeting to order and welcome. Appreciate everybody spending a little bit of time to talk about what's on the agenda. Sorry I couldn't get things added on earlier. Horrible getting caught up, but we'll talk about some other things next time. But the first thing on the agenda is vacancies, and I'm assuming we're talking about vacancies on the advisory board.
So first on the agenda, we need to approve.
Oh, we do
Did I
need
not
to
put it
approve
on
the
there?
minutes from
Yes,
April
minutes
3rd.
from last.
And hopefully you had those sent to you. I'll take a motion to approve them as submitted.
So moved.
Second.
Great. All in favor, aye.
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 Opposed, the same sign. And they are approved. Now we'll talk about vacancies. Christina?
So we still have a vacancy, I believe, for a vet, and with the leaving of Dr. Nelson, a medical practitioner. So those are our two open vacancies at this time. I don't know if anybody has. I have not had anyone apply for either. Well, I take that back. So we do have the gentleman from Centerpoint, who is a registered nurse and does emergency preparedness with Centerpoint, if we want to discuss that. He does meet the definition of a medical practitioner. I know he is not, in the past, what we've done is a licensed physician for that position. I don't know how the board would like to proceed, and what recommendation they would like.
So, okay, so what exactly is his degree or training or education then?
So I believe he is an RN. I can double check. He is an RN. He is also the emergency preparedness coordinator for Centerpoint. So he handles all of their planning aspects and coordinates with the City of Independence actually on many things. He also, I know he's had, he's worked the emergency room, the emergency department as a nurse.
So is he a nurse practitioner then? Or an RN?
I would have to double check. I believe he's an RN. I will need to double check. I do not want to speak out of turn.
I guess
But there's nothing in the bylaws that says that we need to have a physician.
It says a medical practitioner.
And I guess it comes down to what you do, how do you define a medical practitioner? So it's kind of a gray zone, actually. It's I mean, like an NP or a PA at least would have prescriptive authority, but an RN would not. So
That role in the past has, at least as long as I've been on the board, has been filled by usually by the physician representative from
The chief medical officer.
Chief
Yeah.
medical officer from the hospital, and apparently that's not something that's going to happen. I don't have ties with Centerpoint any longer, and so I wouldn't know who's the CMO now. To ask those questions, I haven't reached out to anyone. Dr. Legler, do you still have connections with those folks?
yeah, I don't know. It's a gray zone, and I guess it comes down to how we define a medical practitioner. Or maybe it's not our definition. Maybe it's a dictionary definition, or what's the definition on the state level?
Well, I mean, is there
So at least
some
by-
reason why that, this individual wouldn't be qualified for being on the board. I mean, if it's someone that's interested and wants to participate, then I have no issues.
I personally think the connection with Centerpoint is probably as important as their training credentials, just because they're on the front lines as far as seeing what the community is presenting. You know, most of the urgent and emergent care comes through that system. And with their new facility that's a couple blocks from my house that should be opening fairly soon. They planted all the bushes out front and have the signs hanging. They just haven't uncovered them yet. So I don't know when they're opening that urgent care facility, or actually an emergent care facility. I think having their input is probably valuable to the board.
Yeah, I mean, I think Terry does make a good point. You know, Centerpoint is the only hospital for independents, and they have a official position with Centerpoint, and that certainly means something.
I'm on board. Jason here. I like that linkage idea. I'd support. Do you want a
Do we want to
motion?
make it a, yes, I was gonna say, do we want to make an official motion?
Move to approve this individual as part of the board.
Second.
All in favor, signify by saying aye.
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 Aye. Opposed? Wonderful. The motion passes. Christina, could you send out that information again to us
Yes.
as far as what it is, and we can reach out to him
Yeah, I'll send all his background and credentials to you guys. And I'll also send over to the city clerk, letting her know that, you know, the board would like to recommend his approval for the board.
and then that goes to the council. Is that
Yes,
correct?
and then the council will have to approve. Genesis, as our newest member, knows that sometimes that takes a couple of weeks because it
Yeah.
takes some time to just get on the agenda first. So,
Well,
but I will get that
and
done.
once you get that information to us, then we can reach out to council members that we're familiar with. Dr. McCandless is on, so she'll be aware of what's going on, and we can reach out to other folks that we know and kind of spread the word about what the thinking is behind this plan. So sounds good. Any other questions about the vacancy we're trying to fill? And if everybody would try to pressure into any veterinarian that they know, it's kind of a never-ending process, but the health department spends as much money on animal health as we do human health. And so having a veterinarian on board, it would certainly be helpful as far as helping us in those directions. So I'll reach out to anybody else that I know, and if you would too, that would be very, very helpful.
And the criteria for the vet is they have to either reside in Independence or practice in Independence.
Correct.
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 Yeah, there's only, I mean, we know 2 vets, but one of them I doubt would qualify. Another one might, but we'll have to find out.
Certainly would be helpful. Okay, moving on to fall health events.
Yeah, I just wanted to share. I know so many times we have been focused on, you know, negative, sad things that are going on, especially when it's budget related for the health department. So I wanted to take time and share that we have some events coming up that we're happy about. Towards the end of this month, in 2 weeks, there's International Overdose or Opioid Overdose Awareness Day. We are holding 4 separate events over 2 days. We'll be out at the neighborhood Walmart and the Walmart on 39th Street. We'll also be at the Mid-Continent Library at the Farview Neighborhood Mid-Continent Library, and then the Mid-Continent Library South Independence Branch, I believe. Lauren, correct me if I'm wrong. I'm almost totally sure it's the one off 35th, South Independence. These events typically have been very well attended in the past. We'll be handing out Narcan and providing education on how to use it. We'll also, of course, have flyers about other things that we do and other information, and be there to answer questions. In the past, our ARCH team has also been there as long as they don't have a call to go off to. So they're there to talk about what they do. In September, on September 17th, we will be having a pod exercise, a points of dispensing exercise at the old Adventure Oasis. We'll be there. I am more than happy to send out the information to you guys if you want to either come and participate and have a little bit of fun, or if you would like to just drive through and get some, fake, well, be probably candy. That's what I would like. I'm pushing really hard that it be candy that we distribute, either Skittles or M&Ms as we go through. Lauren, maybe it's not so sure, but she's like that.
Oh, and it's the North Branch for the Mid-Continent Library.
Oh, is it the North
and
Independence Branch? My apologies.
Also be at Fairmount Community Center on the day they have bingo for that
Oh, yes.
this year as well.
So we'll have that coming up in September, and I can send you guys information about that. In September, we will also have 4 Saturdays that from 10 a.m. to 2 p.m. that we will be doing car seat checks in the lower parking lot of City Hall. We have staff that have become certified, I don't know the exact term, certified car seat checkers. That's not right, but they will be going through and making sure that they're installed properly. And for those who have car seats that are either not appropriate for the child by size or that have issues, we do have car seats that we'll be able to give away, and make sure that they're then installed directly into the vehicle and in good shape. So we are going to be doing that during the month of September. So we are excited about those happy events that we get to do and participate in, which get us out in the community and where we want to be. I also am sure that, I wanted to open it up and say, these are our fall health events, but I know that you guys are sometimes involved also in different things that might be going on. And if there's something you guys want to share and let us know, we would love to be able to participate in that. So I tried to make this as vague as possible. If there's anything else we want to include. Open it up? No? Okay.
I do have a question about how
yes.
are we getting the word out on that? Since newspapers is so rarely utilized anymore by the age of people that would be using car seats, is it going to be something that we can push on Facebook and that we can copy out?
So we'll have it on Facebook. We will also, our PIO for the city, our communications team, has already reached out to media in the area. We have at least one that is interested in coming and doing, filming and live, press at the event, to then push it for the other Saturdays also. We are doing our best to get those press releases out and to sell those stories to the local media, because we are aware that, Facebook doesn't reach everybody. Any press release we send out, maybe they'll pick it up, maybe they won't. Newspapers don't reach everybody. We're going to do our best to get as many people to know about it as possible.
It's always nice when we can get the local press to come to town for something good and
something positive that we're doing. Yeah.
Perfect. Questions for Christina at all? Okay, we'll move on to a great topic. So who's talking about vaccinations? Is that you, Lauren?
Yes. Lauren, I'm tagging you in.
That's me. See if I can make it through without coughing. So we still only have vaccines for kids that are uninsured, underinsured, or on Medicaid right now. We're still working on our credentialing for the rest of insurances, but we have been doing that for this back to school season, and we're seeing a decent amount of vaccines. I think I made like 7 more appointments today. I got a lot of phone calls for it today, so those have been going pretty well. And we have a lot of parents who come to get vaccine records, realize their kids aren't up to date, and then immediately make an appointment, which has been nice too. I haven't handed out quite as many exemptions as I did previous years, but they might just also not be calling me now that they know they can print them. But we have been able to do that this year, which has been nice.
Are you getting much pushback on the measles vaccine?
No, most of the ages that we're seeing though are ones needing their 8th grade and their senior year shots. So it's a lot of the meningococcal. We've also been doing, even though they're not required for school, we've been doing a fair amount of the HPV vaccines. When they come in for those, we offer them even though they're not required for school, and most parents opt in. I've only had a couple opt out of doing that one at the same time. And we do have people calling looking for the measles vaccine. We're not always able to provide it to them if they have private insurance, but we help them get set up with a appointment at CVS before they leave the office, so then they can immediately go get the vaccine. But we've had more people looking for it than who don't want it.
Do you know what vaccines still use thimerosal? Because that's
No.
been kind of a hot, well,
Yeah,
you know,
multi-dose measles vaccine still has a tiny amount in it. It hasn't been proven to be a significant amount to have any effect on anything other than keeping it pure. But very, very few places use multi-dose measles vaccines any longer.
We do not.
Matter of fact, I don't know anyone who does. Pharmacies don't. The pediatricians that I know do not. It is still available, but it's rare that anybody uses it. So there basically are no longer any vaccines that have that.
So like the flu vaccine, single or multi-dose, they don't have thimerosal in it at this point, or? I mean, my understanding is was pretty rare. There weren't many vaccines left that used thimerosal anyway.
No, I think measles was it. I can't say that absolutely, but I believe that was the only one that was.
Okay. And on the COVID supply, that, well, it was supposed to come out this fall. I mean, have you heard anything about if that's going to get pulled back or if it's going to be available?
I have not heard any updates yet. I've been keeping an eye out for when we can place any pre-orders through the state if we are going to. With those recommendations changing, it kind of depends on whether or not we'll be able to get it. I know we don't currently have any COVID vaccine in stock for the last season. We did have a decent amount of it, but there wasn't a lot of uptake with it. So we would have enough doses to cover what we thought was the need, and then only like 1 or 2 people wanted them. So all of the vaccine was expiring. But so we've had a few people inquire about it. So I've been making note of about how many are interested so we can order some if it becomes available later in the fall. I feel like it might be a little bit later than what we're used to, but we'll probably still be able to get some at some point.
I'm sure this is a huge question mark going forward right now. So we'll see.
So Lauren, Jason White here. So what is in feel for what our status is on our kid immunization? I mean, how often do we track that? Do you know what our status is? Are we still above 90%? Are we still dropping?
So I'm not fully certain for non-childcare age. So anyone kindergarten and above, I don't have those exact numbers. I've reached out to the state to hear back, but I think I had the wrong contact information. So we're going again. Let me pull up last year. We do our immunization audits every year in the childcare facilities. So we're able to see for childcare facilities what the coverage is. I believe it was above 90. It was better than I thought it was going to be. Let's see where it is. We have the highest exemption rate at a childcare facility I've seen so far is 20%. Most of them have about a 5% exemption rate with, so most of them are closer to 100, but we range from 90 to 100% comply with the exemption rates. So 90 to 100% vaccinated in our childcare facilities, at least. Not sure about the older age groups, though.
Thank you.
My contact at the Missouri state level is no longer at the Missouri state level, so those emails go unanswered, so I haven't heard anything recently about that. So, any other questions of Lauren? If not, we've reached the end of the agenda, and we'll take a motion for adjournment.
So moved.
I'll second.
Okay, all in favor, aye.
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 Aye. Thank you. And next time, hopefully, we're going to have some new and exciting things to talk about. And more good news, we'll hope. Have a good night.
Bye.
Well, I'm glad to see that you're not driving down I-70 while you're on the video.